please make the decision to take care of yourself. Whether it's colonoscopy or a less invasive option, we can get you screened in a safe and effective way. The extent to which patients' GI conditions will impact their day-to-day life will vary according to the person and according to the condition. The symptoms that can be most impactful, for example, in a patient with a severe bowel disorder like chronic constipation or diarrhea or fecal incontinence, well, obviously that can have very significant impacts on their day-to-day life, such as not being able to take that trip, not being able to go to work without constant interruptions. So while there is a fearfulness potentially of patients coming in to talk with us about those things, it can be very important in terms of how they go about their day-to-day lives. I work with a very experienced team. I've been doing this for almost 20 years, and I can tell you I've heard it all. I really have. And that's one of the first things I will tell a patient when they seem a little bit reluctant to talk to me. I have heard everything. You can't surprise me, you can't shock me, but more importantly, I'm here to listen to you, to hear you out. So don't be bashful, don't be afraid. If you're reluctant, take the leap. At least come in and talk with us and see if we can have a dialogue about what's bothering you. I think that there's a lot of value in listening to what a patient has to say and hearing them out, and asking them, why did you come here today? What are you interested in? Some patients are interested in more diagnostic testing, looking at different tests, trying different procedures. Others are very fearful, very averse to doing those kinds of things, and they want to jump into treatment strategies, be it medications or homeopathic options. So I try to prioritize why a patient's coming in and what they're looking for before we embark on that discussion about what do we do next. Beyond the diagnostic testing and the initial phases of treatment, I think I try to impress upon my patients the importance of an ongoing dialogue. I'm a physician. I can't necessarily stop every illness, prevent every disease, etc. However, what I can do is educate you and communicate with you every step of the way. So if I suggest a diagnostic test, I explain to you what's the rationale for this test. If I recommend a certain treatment, I'll explain to you, well, let's talk about why this might be helpful for you. So at every step along the way, I'm trying to educate, communicate, and have a conversation, have a dialogue with my patient. The most rewarding part of what I do is hearing from a patient, I was having terrible fecal incontinence or awful diarrhea. I was afraid to go on my cruise, but I tried the medication, I tried these diet modifications, and I was able to go last month. That is probably one of the most satisfying things for me as a provider to hear. A large chunk of my practice is seeing patients for their initial colorectal cancer screening. And part of that initial visit is discussing what's the best test for you. So we have that discussion in the office about why we do colon cancer screening, when we do colon cancer screening, and why it's so important to get the screening done. How I will often counsel patients is that the only wrong decision is not to get screened. I decided to become a physician at a very young age. My dad was the original Dr. Sloane. He's an ophthalmologist. But I really enjoyed working with my hands. I did not want to spend my time in the operating room. I liked my time connecting with patients. And so choosing a specialty that permitted me to connect with patients and use my hands and doing procedures was a good fit for me. It is so rewarding having that moment when a patient says, you've really helped me. I still get goosebumps on a day-to-day basis when I talk to patients because it really means something. I think that any physician, any medical provider wants that relationship with their patients, wants to feel like they're doing good. At the end of the day, that's what this is all about. So it is why not just I chose to do medicine, but why I'm still doing it, 20 years in, having that connection, making a difference for each individual patient. Really, really important to me.